Hi, a very good evening. So it's been almost ages since we had a live session. So let's have our very first live session of 2021 dinner session. I hope you guys are all ready. So please confirm the audio and video streaming. If you have any issues, drop a comment in the live section. We'll see what we can do to improve the quality, right? So I hope you guys are all ready. So before we start, a very good evening once again, all of you. So, how are you guys doing? Hi, Vinita. Thank you. It's wonderful to hear from you as well, live. So, how are you guys? So, how is? I think in most places of India, summer is about to start. So here at my place, it's almost 30, 32 degrees. So, how is climate at your place? Okay, keep answering. In fact, we'll have a lag of 15 seconds from Zoom to YouTube. So keep answering. In the meantime, as you know, as mentioned this Sunday, that is yesterday, that we'll be having a series of live sessions this entire week. So every day, 8 p.m. IST, we'll have one live session, not exceeding 20 or 30 minutes. We'll have some case-based discussions. And all you need to do is, you need not come prepared. All you need to do is just come with a piece of paper and pen, a notebook, a customized notebook, along with a pen when you're attending the session would be very helpful for you in long term as well as short term, right? So we'll have a discussion in the form of a presentation. So I'll post a question initially, of course, with 4 options, and we'll use that as a core, and based on which we'll have some extended discussion. And also I'll be giving you some homework questions, right? Okay, so I hope you guys are all ready. Everything seems to be streaming fine. So let's proceed. Yes. So welcome to our very first dinner session of 2021. So we'll start with the following question. As I said, it's absolutely fine even if you have no idea, you need not come prepared to these sessions. In fact, it's a dinner session. I know it's very challenging to come prepared. So all you need to do is just observe what's being discussed here, make note, refer, and then of course you can get back in the next session for further discussion or doubt clarification as per your convenience. So this is a context which I wanted to put forth. So as you can see, yeah, a 35-year-old male patient comes with chief complaint of changes in buccal mucosa and vestibule. On intraoral examination, buccal mucosa has cobblestone appearance and vestibule. Also, there are disclosed linear hyperplastic folds in the vestibule, and then glossitis. So these are the intraoral findings. Patient gave a medical history of ulcerations of intestinal tract, regional enteritis. So he was diagnosed with regional enteritis prior. So has this medical history. So in this particular context or condition in which the patient is, what might be the cause of glossitis? So before we jump into the options, I want you to carefully explore the keywords given in this entire case-based or context-based question. This is very, very important. Deciphering is very, very important. Dissecting and deciphering. So as I said previously, case-based question is nothing but a multiple choice question with an additional context or hint or clue. So that it's like challenging you to answer the given question through a context. So if you observe the keywords, so obviously the age and sex of the patient are also equally important. Along with that, you can see chief complaint. So what's the chief complaint here? And also, what are the intraoral findings? And then, is there any relevant, dental or medical history particular to this chief complaint? And finally, what is that they're asking you in this question? So any case-based question, try exploring. I mean, with practice, you can make it faster. Okay, so it's a lengthy one. Obviously, it takes more than a minute or two to answer, but with practice, practice makes man or woman perfect. So these are some of the keywords which I wanted to highlight. Now let's move on to the options. So what could be the cause of Glucositis? Hi. Okay, I'll say hi to each and every one of you before we conclude. Okay, now let's proceed as usual. So you can see the following options. Option A, so you can see the context on top. Option A, bacteria in the intestine. So cause of Glucositis, is it bacteria in intestine? Is it because of malabsorption of vitamin B12? Or is it because of acid regurgitation? Or it has no relation of glossitis with intestinal eruption. So whatever the patient is presenting clinically, oral examination, it has nothing to do with his medical history. So which one do you think is more appropriate answer? I'll give you some time. Go through this once again and try answering it. Even if you are wrong, it doesn't matter as long as you are actively participating in giving answers. Because ultimately, see, each one of us can be right or wrong, but what matters is the effort which we put in. So ultimately, active participation is the key. If you are right, fantastic. If you're wrong, you'll learn, and just make sure you're not repeating these mistakes. That's it. Okay. So what could be the most appropriate answer? Now, try answering this. We'll move into the discussion. If you observe the context, I mean, I've clearly mentioned here regional enteritis. So medical history is regional enteritis. So what is regional enteritis? Regional enteritis is nothing but Crohn's disease. Other name of Crohn's disease, as you know. Okay, so now let's move to the discussion part. In the meantime, you can try answering it. Don't feel otherwise, even if you have no idea about this particular question or answer. So inflammatory bowel disease, as you can see, it's a wider term, it's a broader term, which encompasses two idiopathic chronic inflammatory diseases, as you can see. Onto the left, Crohn's disease, and onto the right, ulcerative colitis. And if the cause is not determined, which is possible in some patients, that is diagnosed or placed under indeterminate colitis. Okay, now let's review some literature, because reviewing literature, especially from standard references, is very, very important, which I try to highlight almost in each and every video. So today our references are from Schaeffer's, as well as a National Cancer Institute website, and also John Hopkins Medicine. So inflammatory bowel disease, as you can see in the process of this discussion, I'll highlight some important points. You can make a note of them. Okay, yeah. So it encompasses two idiopathic chronic inflammatory diseases, that is Crohn's disease and ulcerative colitis. So IBD is a broader term. Crohn's disease and ulcerative colitis are disorders of unknown cause, even though some viral or bacteria have been implicated, but the cause is largely unknown, involving genetic and immunological influence on gastrointestinal tract's ability to distinguish foreign from self antigens. They share many common overlapping clinical characteristics. That's the reason why distinguishing Crohn's disease from ulcerative colitis or vice versa is very, very important. So we'll get back to that in homework question, okay? So in some patients, it is not possible to distinguish which form of inflammatory bowel disease is present, and that is termed as indeterminate colitis, okay? So now you have an idea regarding IBD and the components of IBD. And again, according to John Hopkins Medicine, Crohn's disease, also known as regional enteritis. The same is also mentioned in Schaeffer's. We'll get back to that as well. So regional enteritis or Crohn's disease is an idiopathic inflammatory bowel disease characterized by widespread discontinuous GI inflammation. Although, which areas in GI are most commonly involved? Terminal ileum and right colon. Do make a note of these points, right? So terminal ileum and right colon are the most commonly involved sites, although it can affect any part of GI, starting from mouth to perianal area. Only 1/3 of patients with Crohn's disease have granulomatous inflammation. When I say granulomatous inflammation, I mean microscopically on histologic examination, there can be collection of lymphocytes, plasma cells, non-caseating granulomas consisting of macrophages, epithelial cells, and occasional giant cells. That's a histologic picture. Let's keep it aside. Now, moving on. According to National Cancer Institute, the clinical features are also very important. So the clinical features of Crohn's disease or regional arthritis, based on which we devised this particular question. The clinical features or symptoms include fever, diarrhea, stomach cramps, vomiting, weight loss, and most importantly, there can be increased risk of colorectal cancer as well as small intestine cancer. Just make a note of these clinical symptoms. That is sufficient. Okay. Even if you missed them, you can go through this video once again after the live concludes. Okay. So don't worry. Now let's move on to the clinical illustrations, which is very, very important. So all that we discussed now, it's a bit of theory. It's a background, it's a matrix based on which we can go into this particular slide. So as you can see, we have several clinical illustrations, A, B, C, and D. Observe them very carefully, very closely. I'll be describing each one for you. So illustration A, you can see between the central and lateral, or between the two central incisors, on top of it, on labial gingiva, you can see some pebble-like appearance, or rough ball-like elevations, rounded elevations. So that's cobblestone appearance, which is very, very important. So in illustration A, as you can see, cobblestone lesions on labial gingiva above the central lateral incisor teeth in Crohn's patient. So this is Crohn's patient, or regional arthritis. And illustration B, you can see lateral side of the tongue. You can see ulcerations, which are not very clear in this particular illustration, but still you can make out some linear hyperplastic margins, right, on the lateral surface of the tongue in illustration B. This is again from Crohn's patient. Now, illustration C, you can see another ulcer on palate, but this is from patient of ulcerative colitis. So now, how do you differentiate these ulcers? You can clearly see the difference. Like in illustration B, you can see linear hyperplastic margins. Illustration C, you can see different orientation of ulcer margins as such. So B is from Crohn's, C is from ulcerative colitis. And there are still so many differences, which again we'll get back to in homework questions. So illustration C depicts ulcerative lesion on palate, as you can clearly see, and also observe the shape, size, and margin of the ulcer and compare it with that of illustration B. And then finally D, you can see inner aspect of cheek, where you can see hyperplastic tags or folds of tissue. So these are typical, classical picture or clinical features of Crohn's disease or regional arthritis. Okay. Now, keeping this in mind, let's move on to the oral manifestations. So these are the oral manifestations of Crohn's disease. Let me just review some information given in Schaefer's before we conclude with homework questions. So regional arthritis is a slowly progressive disease of unknown etiology, as we have seen or discussed previously. Although atypical mycobacteria, and in some references they're given even measles virus are sometimes implicated in the etiology, although not in all cases. This can occur in any age. So if you observe the question, we mentioned 35-year-old male patient. So this Crohn's disease can occur in people of all ages, involves both genders equally, and is characterized by granulomatous superficial ulcerations of intestinal tract. And the oral lesions are also more or less the same. The oral manifestations include cobblestone appearance, as you can see on buccal mucosa, labial gingiva, cobblestone appearance. So what is this cobblestone? Cobblestone is nothing but the size of the stone between a pebble and boulder. So it's of intermediate size. You can see it that's being used in constructions or on pavements, right? Cobblestone, illustration A, you can clearly see. So what's a boulder? So if you don't know what a boulder is, then you should watch Big Bang Theory. In fact, there is a song based on boulder size also. Okay. So the most commonly involved areas, oral manifestations in Crohn's disease include cobblestone appearance, and also in the vestibule, you can see a linear hyperplastic folds, illustration D. And also there can be various other manifestations, including granular erythematous swelling, ulcers on palate, etc. Glossitis may be seen secondary to malabsorption of vitamin B12. So along with these oral manifestations, there is another oral manifestation in the form of Glucositis, which could be secondary to malabsorption of vitamin B12 given the medical condition of the patient, right? Okay, so these oral lesions can either precede or follow the appearance of intestinal lesions, and like those lesions can also show periods of presence and exacerbations. Okay, fine. So before we conclude, management part, I will get back to the answer. In fact, I've given you the answer. So how do you manage this condition? So we assume that systemic conditions and oral conditions or localized conditions are separate. Often we assume that way. But this is a classic case where if you treat the systemic condition, Crohn's disease, then oral lesions can also, they subside by themselves. Or we can also treat them by using oral sulfasalazine or intralesional injection of corticosteroids, as mentioned in Schaefer's. They said they provide good results. Or treatment of Crohn's disease as such will address this because this entire body is interlinked. When one system is affected, obviously it is manifested through different phases and different possible routes, right? So that's a management part. Now, before we conclude, again, we have the question, the context, and the option. So which one do you think is more appropriate answer? I'm glad most of you attended and answered this question. Very good. So malabsorption of vitamin B12 seems to be the right answer. So bacteria in intestine, in fact, healthy flora are essential for normal peristaltic movements and for maintaining interior over there. Regurgitation of acids, no relation to glossitis. We're clearly seeing the relation. So malabsorption of vitamin B12 could be a secondary complication or associated with this regional enteritis or Crohn's disease. Fantastic. So I hope you got the context. You understood the options and also why option B is more appropriate answer. So let's conclude here. So context-based, case-based questions are easy to answer if you're confident. So as I said, it's not that these are very tough to answer. In fact, these help you to answer by providing you relevant context and relevant inputs, right? So before we conclude, I have the following homework questions for you. 1, 2, 3, 3 questions. So let's do, you guys can refer and let me know the answers tomorrow in tomorrow's live session. Before we start our next live session, we'll start with these questions. The first question is, you can make a note of, which element is the constituent of vitamin B12? You have so many elements in body, iron, manganese, phosphorus, cobalt, carbon. There are so many elements. So which element is the constituent of a vitamin B12? So that's the first question for you. The second question is, what are the differences between Crohn's and ulcerative colitis? In fact, in clinical illustrations, we have seen the orientation, shape, size, and margins of ulcers. So what are the differences between Crohn's disease and ulcerative colitis? Distinguishing is very important so that you can institute treatment accordingly. And third, while describing or discussing the histologic part, I mentioned that this mimics or this represents or this appears like a granulomatous disease. And also I mentioned about presence of non-caseating granuloma. So what does the term non-caseating granuloma mean? Because in tuberculosis, we find granulomas. We call it caseating necrosis. But here we're talking about non-caseating granuloma. So what does it mean? So these are the 3 questions which I have for you, right? So I hope you made a note of the same, and we'll start tomorrow's live session with these questions, right? I hope it's clear. You have any queries, you need any further clarifications, of course, feel free to get back through mail 24/7. Okay. I opened Zoom after a long time, almost after 35 or 40 days. To my surprise, last year we discussed about Zoom dysmorphia syndrome, if you remember. Those who are using Zoom because of pandemic and all lockdown, most of them had to use Zoom for work and teaching and so many other things. Many of them faced psychological issues because there were no filters incorporated in Zoom app, like in Insta, Facebook. We don't have filters in Zoom, but you know what? They have incorporated filters now. I was surprised to look into it. So there was news about Zoom dysmorphia syndrome, but now I think there is no such issue because of the availability of filters. There are plenty of filters available. So those who don't know about this, so you can just check out various filters and communicate either for personal or official work using those filters. By the way, I'm using one filter now. Yeah, it's cinnamon. I don't exactly remember the name, but I'm using one filter now. Even though I didn't have suffer from June dysmorphia syndrome, but still, I felt I should try at least one filter. Hi, Shravani. Shravani, hi, Shravani. A very good evening. Hi, Kavita. Hi, Ankita. A very good evening. Harita, Stuti, Dento Villa. Thank you, Dento Villa. Dento Villa says, waiting is over. Dinner and good morning sessions are best videos. Thank you for the feedback, Dento Villa. Much appreciated. We'll try to incorporate more live sessions, and also we'll plan debate sessions in the coming days and coming weeks. Hi, Google user. Hi, Halo. Shravani. Shravani is asking about counseling. It's already second week, no info about counseling, how long to wait. I mean, this is something which you should post to mcc.nic.in. Mostly second or third week, usually the dates are released 13th or 14th, as mentioned in one of the previous recorded videos, right? So just keep a tab on mcc.nic.in. And Shravani, you know what? There is a secret to those who wait, good things happen. So keep waiting. So good things will definitely happen. Don't worry about that, okay? And also keep a tab on, mcc.nic.in. Hi, Vinita. A very good evening, Harita. Ritu. Yes, Ritu, I know. Nature's magic inside you. I know you're Ritu. Good. Good to hear from you. Hi, Gargi. Hi, Shruti Kirti. Smriti, Renuka, Komal. Yeah, Pallavi. Hi. A very good evening. So I hope the format is fine. So we'll continue with this format for the next 4 to 5 days till Friday, as per the schedule released on Sunday. So every day we'll deal with one context-based or case-based question, and on Saturday I'll also try conducting one general session and share my travel experiences. I'm in fact looking forward to do the same, right? So I hope you made a note of these homework questions, and it will be very interesting. I mean, differentiating Crohn's and ulcerative colitis element, which is a constant of vitamin B12, and most importantly, what is a non-caseating granuloma? I mean, these are the questions which popped in my mind during the process of preparation. So I'm sure you're going to answer them, and make sure you're referring standard literature only. Okay. And for any further guidance or clarifications, feel free to get back to me 24/7. Right. It was after a long time conducting this live session. It's a lovely, amazing feeling, and I really appreciate your active participation. Just keep working, keep giving your best. Consistency is the key, and most importantly, believe in yourself. Okay, it's all in here. Believe in yourself. Take care. Good night. Saranya, you missed the session. Don't worry. The good news is we will edit this and post it as soon as possible. You can go through the recorded format, and you can all join me again tomorrow at 8 p.m. Indian Standard Time, and you can also join our updates group in Telegram. And also you can check out the details of our latest batch Neo 9, which we are launching this week towards NEET MDS 2022. Right. Take care.